Okay, the recording has started.
Great. Patrick, should I go ahead?
Yep. Go
All
right
right.
ahead.
Thank you. Hi, everyone. This is Lindy Hinman. I'm calling to order the Boulder County Board of Health regular meeting. It is August 10th, 2026, and we are right on time at 5:30. Could each board member please introduce yourselves?
We'll start online. Morgan?
This is the more. Okay.
Go ahead, Landry.
Oh, sorry. Landry Fagan, board member.
Morgan McMillan, board member.
That's it, board member.
Stephen Newman, board member.
Okay, thank you. We have a quorum, and we're noticing that this meeting was posted on the Board of Health website and that all call-in information and address was included to allow for public participation. We're now going to move into the agenda, and we'll announce each item as they come up. First, item number 1, Patrick, is there any public comment scheduled or unscheduled tonight?
No, no one submitted for any public comment tonight.
Okay, great. Thank you. All right, moving to item 2, we're going to do approval of prior month's meeting minutes. I make a motion to approve the meeting minutes from June 8th, 2026. Can I get a second?
Second.
All in favor?
Aye.
Aye. All right, motion approved. Thank you. The minutes are approved. All right, we're going to quickly move to item 3. We're going to talk about the adoption of the amended OWTS regulations, and I will now turn it to Lexi and the staff to walk us through this topic.
Thank you very much, Lexi Nolan, Executive Director of Boulder County Public Health. Thanks for this evening. Appreciate this continued conversation on passing the new OWTS regulations proposed by the state and adapting. We are adapting them this evening for Boulder County. I'm going to go ahead and turn it over to Rachel Arndt to present a summary of the recommendations.
Great, thank you. Can you all hear me okay?
We can.
Yes.
Okay, great. Sorry, I'm remote tonight. Rachel Arndt, Environmental Health Division Manager, Boulder County Public Health. Thank you so much for having us tonight. My colleague, Erin Dodge, the Water Quality Coordinator, is in person tonight to assist if there are any questions. We can move on to the next slide. And the next slide. The proposal before you tonight incorporates recent feedback from the Board of Health and was developed in consultation with the County Attorney's Office. These proposed regulations align with the requirements set forth by CDPHE in 5 CCR 1002.43. They minimize public health risks from OWTS, allow for data integrity and modernization, and minimize requirements and costs for property owners while aligning with sustainability, transparency, and stewardship goals of the agency. We request that the Board of Health vote to approve and adopt Boulder County Public Health OWTS regulations as revised and as presented in your Board of Health packet tonight. Next slide, please. Since the May 11th Board of Health meeting, staff have consulted with the County Attorney's Office to revise our regulations. Staff amended the following permits to align with Board of Health and County Attorney feedback and assure alignment with CDPHE 5 CCR 1002.4. Additional details outlining the purpose, public health risks, and specific changes to each permit type detailed in your Board executive. Change in use permit was clarified, and the authority for these permits.
Hey,
Regulations.
hey, Rachel.
Yes.
Rachel, we're losing you.
We're losing your
Okay.
sound in and out.
Is that better?
Oh,
Yes.
Yeah, that's
is
much
that better?
better.
Can you hear me? Okay.
Yeah.
I took my headphones off, sorry. The change in use permit was clarified and the authority for the permit was specifically listed in the regulations, as well as clarifying that these apply to a point in time assessment. The maintenance permits the applicability was clarified to apply to higher level treatment systems. Property transfer permits were adjusted to ensure alignment with the minimum criteria outlined in 5 CCR 1002.43, and the staff and county attorneys added an unapproved wastewater discharge definition. Operating permits were also clarified, narrowed, and the authority was listed in the regulations. Next slide, please. A detailed table at the end of your executive summary describes other proposed changes that were presented at the May 11th Board of Health meeting. No changes have been made to these proposed regulations, which improve efficiency and operations and implementation of the OWTS program. We are requesting that the board approve and adopt the following changes: the addition of several definitions that provide clarity to the regulation. Number 2, allowing staff to approve property line setbacks versus requiring those requests to come to the Board of Health for approval. 3, requiring monitoring pipes in 4 corners of the soil treatment area. 4, allowing for the soil treatment area reductions with waterless toilets. 5, moving from a 1 to 2 year licensing for system contractors to reduce administrative burden. And 6, clarifying permit expiration dates for the purpose of data integrity. Next slide, please. We welcome the board's questions, and we request your approval and adoption of Boulder County Public Health's OWTS regulations tonight.
Great, thank you so much. I do know that I want to make sure the board knows, and Morgan, please chime in, that we have evaluated this in the Governance and Budget Committee very extensively, have been working with the county attorney's office to ensure alignment with the attorney's office. And Morgan, I don't want to speak for you, but I think from the committee perspective, we're very supportive of moving forward. So I just wanted to make sure that the board members understood that this has been evaluated from that perspective.
Yeah, I echo that, Lindy. Thanks. I think, thanks to the staff for their extensive work on this. And I feel really good about where we landed and really appreciate their coordination also with the county attorney's office, who's been really supportive throughout this too. So thanks. And yeah, I support it. I think we need a motion to adopt the proposed ordinance.
Yeah, are there any questions from other board members or comments just before we move to vote?
I don't have any additional questions.
I don't have any questions or comments.
Okay, great. Landry, are you good?
I'm good. Thank you.
Yeah, absolutely. Okay, Morgan, with that, I will make a motion to approve the amended on-site wastewater treatment regulations as prepared and presented by Boulder County Public Health. Can I please get a second?
I will second.
Second.
Thank you. All in favor?
Aye.
Aye.
Aye. All right, we've got the motion approved. Rachel, Lexi, team, thank you so much. To underscore what Morgan said, I know this was a lot of work, a lot of thought, and a lot of alignment behind the scenes. So thank you for that. And we really appreciate the time you've put into this.
Thank you very much.
Thank you. And many thanks to Aaron and to Kate, who did a lot of the heavy lifting.
Thank you.
Thank you, Aaron and Kate. All right, great. Moving on, we will go to item number 4, which is the director's report, and I'll turn to Lexi.
Good evening, Lexi Nolan, Director at Boulder County Public Health. We are kind of revising how we're going to report on the director's report going forward. Historically, unless there was something urgent that I needed the board to know about, we would tend to flow through it. But as we are beginning to kind of really focus our Board of Health meetings on issues that the board needs to make decisions on, that we are looking for direction on, very kind of a bit of a narrower focus. I will take a little more time with the director's report to highlight a few things that are happening in the agency, particularly things that may have been presented as a program spotlight in the past. Do want to mention that our staff is working with a statewide coalition to provide technical input and recommendations on the coal ash legislation. This is being sponsored by Senator Amabile, and we're very pleased to be involved in this process. We have a number of staff who have technical expertise and subject matter expertise who are contributing to it, and Tessa is also helping to coordinate the group. So thank you for that. The next one I want to highlight is.
Hey, Lexi, before you move off that topic, could you just give a little bit more commentary on what the legislation is covering and why we're excited about it?
I'm going to turn it over to Tessa, who is here right now.
Sure. Tessa Hale, policy lead. This is something that the environmental health group has been working on for decades. Erin on the water quality piece, Bill Hayes on the air quality, Gabby Hopfler, Carl Job, all taking a look at that former power plant site, the big tower on East Valmont, which is out of commission, and Excel is going to be basically digging up all the coal ash, and then it's for beneficial reuse to create cement. Anyway, in the process of doing that, there will be a fair amount of dust proliferation, and it impacts communities, in particular. The Valmont Community Coalition is sort of the group of folks who are lower income folks will be adversely impacted. So there's a coalition that we've been engaging with for a period of time to understand their concerns. There's Rachel Arndt reached out to the law clinic on natural resources at CU, and there's a student who's going to be doing research on best practices for this kind of legislation. It impacts not just Boulder, but I think there's a total of 5 old power plants like this that will be going through this. So we're collaborating with the City of Boulder, Valmont Community Coalitions, and environmental groups to provide feedback. And it is one of Senator Amabile's 2 priority pieces of legislation for this year. So, you know, we're really excited to be able to provide all of the brain power of the scientists on our team who know, you know, how best to create the gold standard of cleanup and beneficial reuse.
There are a number of additional coal burning facilities that will be taken offline in the future in Colorado. So it's important that we get this legislation right to set the expectations. And this will be the first of its kind legislation in the state.
Lexi, does this legislation require any significant work from the agency?
This is what, well, this is one of the conversation pieces that we're looking at is enforcement. Do you want to go into more detail?
Sure. Yeah, I think so. This really falls under CDPHE's purview to be managing this. But I think what the concern with the community is that when it gets really windy here, if there's suddenly a lot of dust in the air, that the stop work by the time sort of, you know, a report is made to CDPHE to shut down work, it's too late. And so it's like, what are the mechanisms by which Boulder County Public Health or another local public health jurisdiction could order a stop work, and then CDPHE would go through the process of getting it back open and doing so in a way that doesn't unduly burden this agency for the capacity that we have. So that is part of the conversation with Amabile and her staff. Does that answer your question?
Yeah.
Okay, shall we move on?
Yeah, thank you.
Thank you, Tessa, and to all the folks on our team who are contributing to that work. Want to mention that the WIC program's new baby cafe is going to be launching in August. We're very excited about that. This is an opportunity to get moms together for social supports, for lactation training, for a lot of opportunities. Daphne, you want to say a few words about that real quick?
We're just really excited. This is a national model and you have to get syndicated, and we've gotten syndicated and they got our payment. So we're kind of doing a soft launch in Longmont first. And once we get our feet under us, we'll also expand into Boulder. So hopefully it'll be very well received.
Yep. And do you have any specific updates for Family Connects? I know you had mentioned it in the director's report.
Yeah, just the director's report, if you all have seen it. And we had the head of Family Connects International, Jade Woodard, came and visited us today. And that was
wonderful.
great. And she is working at the national level on policy to support a case rate being created. At the local level, we may find that we could use some support with PICPUF, Healthcare Policy and Finance, and CDEC.
But this would be to allow Medicaid to reimburse.
Specifically for a case rate, because what's happening is in January of 2027, what has traditionally long been a bundled case rate in the maternity world is becoming unbundled. And so anyway, lots for us to be aware of, and even creating any of this extra coding would require some Medicaid funding behind it. So anyway, we're hoping to build a case. We may get to a point where we ask the board for some advocacy if that comes to fruition.
Thank you, Daphne. Thank you. Any questions for Daphne? Okay, I'm going to mention a few public health issues that have come up over the summer. We have been, the whole Denver Metro North Front Range region has been in severe ozone non-attainment repeatedly. It's not particularly new, but there is a deadline of next summer for the EPA to assess regional attainment for the 24-26 period. We will be watching that. The only level worse than severe is extreme, which an example of that would be the Los Angeles basin right now is an extreme ozone non-attainment. This continues to be a concern for us because the funding for air quality in public health continues to fall and fall and fall year after year. It's been falling for 20 years. And it is a very skeleton crew at this point. And it makes it very difficult for us to mount any kind of a local response. We do have a number of trending outbreaks right now. I think everyone in the country has heard of the cyclosporiasis cases. We do have some in Colorado, in Boulder County. We did recently have a potential Legionella outbreak. It did not turn into a full outbreak, and it was not associated with the facilities in which we had long-term care patients living. We were not able to identify what the source of that was. We do have our first case of West Nile virus in Boulder County for this year. This was a resident from Longmont, and that resident's recovering now, so that's good news. We don't have any new active TB cases, which is wonderful to hear. This is work that we contract out to Denver Public Health because it is much more cost effective for them to do it on a regional basis than for us to run our own program. There have been TB cases identified in the Aurora Immigration Processing Center. The Adams County Health Department is currently in a little bit of a legal battle with GEO over the right to go into those facilities and require public health standards to be met. We also have heat advisories that we've issued a number of heat advisories. I think you all know it's been extraordinarily hot here lately. We are waiting for the cool weather, but we are very grateful that we have not had any fires so far because the monsoons should be right around the corner as the beginning of our El Nino year. We have had a lot of wildfire smoke and poor air quality because there are so many fires across Colorado. Our hearts go out to the folks in Washington and in Canada, where we see so many acres burning, but it's really becoming quite a national issue every summer. We don't have a wildfire season anymore. It's becoming year round. Wanted to let you all know that the Boulder County Public Health Annual Report is now available online. If you want to send that to your friends and family, make sure they know what you've been doing with your spare time. We're very proud of the work that we were able to do in 2025 and even more excited about 2026. And then lastly, I just want to do a few staff and agency recognitions. A number of our staff, our programs won the NACO Award, which is the National Association of Counties 2026 Achievement Awards, including our tobacco education program, the priority-based budgeting work led by the A&F team, and the water quality team, all won awards. Also, our works program works with the DA's office for the harm reduction diversion program, and that also won an award. The priority-based budgeting work was recognized nationally as at the National Association of City and County Health Officials for, as a promising practice. One of our staff in the IEC-MHC early infant and early childhood mental health consultation program, Bethany Garrett Myers, thank you. I'm getting better at that one. Won the most distinguished clinician award from the Colorado Society of Clinical Social Work. We're really proud of her. That is exceptional work that team does, and to be recognized among a group of clinical social workers is a high bar. The HEAL team's prenatal produce RX program, which I think you all know I have a soft spot in my heart for it because it models Jack Geiger's work in the 60s that really started so much public health work. Is doing great. Were highlighted in the county's monthly newsletter magazine. It's not really a newsletter, it's a magazine to all county staff.
Close to the public too.
Yes.
Yeah, I get them held in my.
Oh, no, that's what I mean. It's the county's magazine for the public.
Right.
Yes, thank you for that clarification. All right. We have a couple of staffing promotions. Carly Wilson is now half-time between Vector and overseeing the ECE inspection program, which I think is going to be a great match. She has great experience in both spaces. And Anaï Michel has been promoted from our grant accountant to our grants manager. The final thing I'll mention is that on August 26th from 10 to 11 in the Lafayette Hub, we will be having a celebration for the CalFO Legislator of the Year recognition. The two legislators that are being recognized this year are both from Boulder County. Representatives Kyle Brown and Karen McCormick. And they were selected for their strong support of public health during a very challenging legislative session. And we would love it if Board of Health members are able to come. That would be terrific.
When is the date again, please?
August 26th.
And it's
10 to 11 in Lafayette.
I'm going to forward you the invitation right now.
okay, thank you.
And that is all I have for the director's report this week.
Okay, great. Any questions about the director's report?
I don't have questions, but I think the dashboard that was shared was really impressive.
Oh, great. Thank you.
Yeah. Strategic priorities dashboard that we were able to look and filter through and to look by date and see improvements over time.
That's wonderful.
Yeah.
Thank you for that feedback. We'll make sure the team knows.
Yeah, and I also will just add, I appreciated the deep dive on Family Connects and what's going on in that program. So thank you for that, Lexi and the team.
Thank you, Daphne.
Thank you.
And the
Great.
family
Well,
voice-
congrats to the staff. A lot to get excited about in terms of the awards. That was a long list of awards to read in the director's report this month. So thank you for
Yes.
that.
The Family Voice Ambassadors work is really impressive. You guys are going to be at Public Health in the Rockies
Yes,
with that?
they will be presenting. Yeah. So, thank you. I really appreciate it. Thanks so much for reading, celebrating with us.
Awesome. Any other comments, questions? Thank you as always for putting that together, Lexi and team. I think we're on to old and new business. Any old, new business or announcements?
No business.
Okay.
Nothing in the room.
Wow, you guys, this may be the most efficient meeting I have ever attended in my tenure. And fabulous. Thank you. It's summer. We all deserve to go out and enjoy the sunshine while it still lasts this late in the day. So we'll move to item 6, which is adjournment. There being no further business, this meeting is adjourned at 5:56. Thank you so much.
Thank you all.
Thank you.
Thanks, everyone.
Bye,
Yeah,
guys.
Amazing. Bye.